Joining us now to tell us more about these latest developments is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, welcome back to Forum Daily.
Always a pleasure to be here.
So let's start with Pfizer's new COVID-19 pill, Paxlovid. What do we know so far about it, Doctor?
Well, Paxlovid really contains two medicines, the nirmatrelvir and the ritonavir, both antivirals. Nirmatrelvir is a protease inhibitor, which means it works by blocking the viral replication in the early stages of the disease to really prevent progression to severe COVID-19. Ritonavir is really given with nirmatrelvir as a booster in many ways to help slow that metabolism and keep it in the body for longer periods of time with higher concentrations to combat the virus. So the medication is typically taken twice a day for 5 days. And some trials have shown that Paxlovid actually reduces the risk of hospitalization and death by 89% when medications are started within 3 days, beginning of symptoms, and up to 85% if started within 5 days.
Sounds very promising, Dr. Raut. So how does this pill compare to getting vaccinated when it comes to your immune response?
All right. So when we look at Pfizer specifically, the vaccine had a 91.3% efficacy against symptomatic COVID-19 infection. It was also found to be about 89% effective in preventing severe disease. Now, these numbers were relevant before Omicron, and what we understand is 2 shots may just not be enough with Omicron. So for Omicron, what we do know is a more robust protection is achieved by a 3rd dose. The booster gives you an antibody titer about 25-fold. And the third dose does provide a similar level of neutralizing antibodies to Omicron, as we saw those numbers from even before.
So what does this new pill mean for our continued fight against the virus?
Well, I think it's an excellent addition to our arsenal against COVID-19. We do know that there are going to be issues. Dr. Theresa Tam has discussed that the supply of Paxlovid will be an early issue for sure, meaning likely the treatment is not going to be having much of an impact in the current Omicron wave. Canada has received about 30,000 courses already and 120,000 coming through after March.
Now, talking about Dr. Theresa Tam, she mentioned that Omicron is infectious for up to 10 days. So what does that mean for provinces that have shorter isolation requirements?
That's right. So very confusing area for sure. 3 weeks ago, the Center for Disease Control in the States cut down their period from 10 to 5. And it was based on a lot of evidence supporting that the infectious period may have been about 3 to 4 days. Public Health Agency of Canada still recommends that we go for 10 days, even after they test positive or symptoms begin. And there is evidence to support that as well. Unfortunately, every province and territory has stopped following that advice, starting with Ontario and Saskatchewan. Most provinces actually have reduced to 7 days, and a few others have reduced to 5 days there. So in Canada, those rules are set by the provinces and territories. And so really the provincial governments have the final say in isolation rates.
All right, Doctor, just about a minute left here, but Dr. Tam also said on Tuesday that the pandemic may end with an endemic form of the virus. So that sounds very interesting. What would an endemic form of the virus look like?
Right. So it certainly would look it would look complicated. I think what we're trying to see is whether that means mild disease. And the truth is it doesn't. An endemic disease does not mean a mild disease, and a mild disease does not mean an endemic disease. For instance, malaria killed more than 600,000 people in 2020, and it's considered an endemic disease. So overall, we still have a lot to go through. And I think when we see endemic, people will live with it, but not painlessly.
All right, Dr. A quick 30 seconds left here, but what is your recommendation for Canadians who are afraid of catching this extremely infectious Omicron variant?
Right, so it's a confusing time with a lot of conflicting advice. So we should keep to basics, hand wash as much as you can, wear a mask as much as possible, follow the local isolation protocols, and if you haven't already, get your vaccinations and boosters.
Dr. Raut, always great having you on Forum Daily. Thank you again for your time today.
Thanks so much for having me.